Hi folks, Dr. Kumar here. Earlier this week, I did a deep dive solo episode on magnesium. I got a bunch of very thoughtful questions, so I thought I'd pick 5 of the best ones and do some mini deep dives on each of them. I think this will tie together most of what we covered earlier in the week and fill in a few gaps that are worth expanding on. Okay, so the first question was, my doctor tested my magnesium last year and it came back normal. So why are you saying I might still be deficient? This is probably the most common source of confusion around magnesium, and I want to address it directly because I think this is actually a failure point in how we practice medicine. The standard serum magnesium test only measures the magnesium floating around in your bloodstream. And here's the thing, less than 1% of your total magnesium is in your blood. About half is locked into your bones, another 40% is inside your cells, and mostly in muscle tissue. The blood is not where magnesium lives. It's a tiny reservoir that your body tightly regulates. So your serum can look totally normal while your tissue levels are actually running on empty. This is well documented in the clinical literature. In fact, a review published in Open Heart in 2018 pointed out that normal serum magnesium is not the same as adequate body magnesium, and that the widespread assumption that a normal lab result rules out deficiency is clinically misleading. The more accurate test is something called an RBC magnesium, which measures magnesium inside your red blood cells and gives you a better window into your intracellular status. Even that isn't perfect, but it's considerably better than serum tests alone. The most revealing test is an intravenous magnesium loading test, but that's not practical outside of research or a critical care setting. The takeaway on this question is, if your serum magnesium comes back normal, but you have symptoms like poor sleep, muscle cramps, anxiety, low energy, or elevated blood pressure, that result doesn't close the door on magnesium deficiency. It's worth having a conversation with your doctor about RBC magnesium, and it's also worth asking whether your diet and lifestyle put you at risk. Honestly, I think the best way to tell if you're magnesium deficient is just taking a magnesium supplement. If you take one and you get better, then that basically answers the question. It's a very low risk intervention and it might have tremendous upside. Okay, so the next question is, can magnesium actually lower blood pressure without medication? I feel like that sounds too simple. That's a great question. So I actually thought the same thing before I went into the literature on this one. But the data on magnesium shows real effects on blood pressure. A systematic review and meta-analysis published in Hypertension in 2025 pulled data from 38 randomized controlled trials involving nearly 2,700 participants and found that magnesium supplementation reduced systolic blood pressure by about 2.8 millimeters of mercury and diastolic by about 2 millimeters of mercury. And that's compared to placebo. In patients with hypertension who were already on blood pressure medication, the systolic reduction was closer to 7.7 millimeters. And in people with documented low magnesium, it was nearly 6 millimeters systolic. So those are not trivial numbers. On a population scale, a 2 to 3 point reduction in systolic blood pressure consistently reduces heart attack and stroke mortality in a very meaningful way. The mechanism makes complete biological sense too. Magnesium is a natural calcium channel blocker. It promotes vasodilation by helping blood vessels relax and widen. Calcium channel blockers are an entire class of prescription blood pressure medications, and magnesium does something very similar, just more gently and physiologically. I think the reason this gets dismissed is that we've been trained to think in terms of drugs, but the mechanism here is real. The evidence is real, and it's worth paying attention to, especially if you're trying to address blood pressure issues through lifestyle interventions first. Okay, so the next question. I've noticed I sleep way better when I take magnesium. Is there actual science behind this, or is it just placebo? Okay, another great question. There is real science behind it, and the mechanism is not complicated once you understand what magnesium is doing in your nervous system. In the magnesium episode, I talked about the NMDA receptors and the GABA receptors, but let me summarize. Magnesium physically blocks a receptor that your excitatory neurotransmitter glutamate activates. That's the NMDA receptor. When magnesium is present, it makes it harder for your neurons to fire unnecessarily. And at the same time, it enhances the binding efficiency of GABA, which is your brain's primary calming signal. So when you're deficient in magnesium, you lose both of those effects at the same time. Your brain becomes hyperactive when it should be winding down. and you end up with racing thoughts, trouble falling asleep, or trouble staying asleep. The clinical evidence is mixed depending on which studies you look at, but the more recent trials are encouraging. A randomized controlled trial published in 2024 tested magnesium l-threonate specifically in adults with self-reported sleep problems and found that compared to placebo, it significantly improved deep sleep scores, REM sleep scores, and daytime functioning, including mood, energy, and alertness. A separate 2025 trial on magnesium glycinate found statistically significant improvements in insomnia after 28 days of supplementation. So the effects seem most consistent in people who are starting from a place of deficiency, but I take it daily and I swear that it helps with my sleep. If your levels are adequate, topping up probably won't hurt you. But if you're depleted, which given the fact that the NHANES numbers is more than a coin flip that you are, supplementing magnesium, especially glycinate or threonate in the evening, has solid mechanistic and clinical reasoning behind it. So to the person who asked this question, the fact that you've noticed a difference in your sleep while taking magnesium lines up well with what the literature suggests. Okay, so next question. I have type 2 diabetes. Does magnesium actually matter for blood sugar control? Or is this one of those things that sounds good but doesn't really pan out in the data? Okay, well, let me tell you right now, it does pan out. The data on this is actually one of the stronger stories in the magnesium literature, and I think it deserves more attention than it gets clinically. On the epidemiological side, a meta-analysis in 2011 found that higher magnesium intake was associated with a 22% lower risk of developing type 2 diabetes. That association held across different geographic regions, sexes, and follow-up lengths. A later dose-response analysis confirmed a linear relationship, meaning that for every 100 milligrams per day increase in dietary magnesium intake, the risk of diabetes dropped by somewhere between 8 and 13%. And magnesium deficiency is also important in people who already have diabetes. Up to 48% of people with type 2 diabetes have low serum magnesium, which, as we discussed before, probably understates the true intracellular deficiency. Magnesium is a cofactor for enzymes involved in insulin secretion and glucose metabolism. And when it's low, insulin resistance gets worse. When you restore it, insulin sensitivity improves. The mechanism is clear, and the clinical trials generally support it, particularly in people who are starting from a deficient baseline. If you have type 2 diabetes, and you haven't specifically discussed magnesium with your doctor, it's worth bringing up. It's not a replacement for your existing management, but given the data, it's a meaningful piece of the puzzle that often gets dismissed and might help you significantly. Okay, so next question. There are so many forms of magnesium on the shelf. How do I actually choose one without guessing? Well, we talked about this in the podcast, and I understand how confusing this is because the supplement industry has done a great job of making it seem more complicated than it needs to be. And some of the forms on the shelves are genuinely not worth your money. The first thing to know is that bioavailability matters more than milligrams on the label. Magnesium oxide has the highest magnesium content per pill, but your body absorbs roughly 4% of it. So it basically just acts as a laxative. It's what's in the vast majority of multivitamins, and it does almost nothing to correct a systemic deficiency. So skip magnesium oxide unless constipation relief is your actual goal. The forms worth knowing about are organic chelates, where magnesium is bound to an amino acid or an organic acid. So magnesium glycinate is my personal favorite for sleep and anxiety. It's very well absorbed, gentle on the stomach, and the glycine it's bound to has its own calming properties as an inhibitory neurotransmitter. So you're getting a double benefit. Magnesium citrate is the most widely available, affordable, and well-studied option for general supplementation. Just be aware it has a laxative effect at higher doses. And then magnesium threonate is the form with the best evidence for crossing the blood-brain barrier. And based on that randomized trial I told you about earlier, it appears particularly useful if cognitive function and sleep quality are your main targets. And then there's magnesium taurate, which pairs magnesium with taurine, which supports cardiovascular function. So that's worth looking into if your main concern is heart health or arrhythmia prevention. And magnesium malate, which is bound to malic acid, is often used for energy and muscle pain and has some interest in conditions like fibromyalgia. As a general framework for overall deficiency correction, start with citrate or glycinate. For sleep and anxiety specifically, glycinate is your best bet. For brain health and cognition, threonate. For cardiovascular support, taurate. And finally, for muscle pain and fatigue, malate. And you should generally keep your elemental magnesium dose under 350 milligrams per day from supplements. So start low at around 200 to 300 milligrams, split the dose if you have to, especially if it's bothering your stomach. And one last thing to watch for on labels is that some products blend multiple forms, which can be smart since different forms may distribute to different tissues. But make sure that magnesium oxide isn't making up the bulk of the blend. You want to make sure that magnesium is actually conjugated to the organic acids and amino acids that help with adequate absorption. The label tells you, so just take a look. Okay, so I hope the answer to those questions helped you understand magnesium a little better. I'll see you next week. Cheers.